I'm Christopher Knowles, and along with my supervisory team at Ulster University, I conducted a study into the psychological implications of COVID-19 for athletes. COVID-19 and the resultant lockdown has constituted a critical life event for all of us, not least of all athletes. The UK's national lockdown on the 23rd of March brought competitive sport across the country to an abrupt halt. An event of such magnitude should be considered as a major transition in the life of an athlete. In sports, the mental health effects of other transitionary periods such as injury and retirement are well documented. Many injured athletes and those embarking on their retirement have reported feelings of depression, anxiety and poor well-being. Some studies have presented evidence to suggest that these outcomes seem most likely to occur when an athlete exhibits a strong and exclusive athletic identity. Such an identity can engulf an athlete's sense of self, leaving them prone to negative psychological consequences when they cannot participate in their sport. We suspected that similar outcomes would occur as the result of COVID-19. That being said, there is a long-standing association between sport participation and the development of resilience. Some studies have even found that due to their experiences in sport, athletes can often be more resilient than non-athletes. Which then poses the question, when compared to the rest of the population, how well have athletes managed to cope with the psychological implications of COVID-19? We aim to answer this question and shed some light on the differences in athlete and non-athlete mental health. We wanted to understand the relationship between resilience, athletic identity, and the mental health factors most commonly associated with transition periods, that is, depression, anxiety, and well-being. To measure mental health, a number of well-validated self-report measures were used. Key's mental health continuum was chosen for its ability to offer an insight into whether participants might be flourishing, languishing, or are otherwise moderately mentally healthy. As well as this, the Hospital Anxiety and Depression Scale can predict the possible and probable likelihood that a disorder is present. The remaining two scales do what they say on the tin. One offers a single measure of resilience and the other a three-factor measure of athletic identity, which comprises of social identity, exclusivity and negative affectivity. We conducted a survey spanning the 2 weeks following the UK's emergence from its national lockdown. Data was collected anonymously from 753 consenting participants, all over the age of 18, with a fairly even split of males, females, athletes and non-athletes. We hypothesised that, as per existing literature, resilience would be higher in athletes than non-athletes and positively correlated with mental health. We further predicted that athletic identity would be negatively correlated with mental health. Our findings revealed that athletes were slightly more resilient than non-athletes. There was also a small gender difference, with males being slightly more resilient than females. We also observed moderately strong correlations between resilience and all our indicators of mental health. But potentially the most interesting thing about our study was that when we tested for differences in athlete and non-athlete mental health, there were very few to be seen, despite athletes having greater resilience. In fact, athletes actually reported being more anxious than non-athletes. This could be related to our third main finding, which was that whilst overall athletic identity wasn't associated with mental health, individual factors within it were. These associations remain significant after controlling for the mediating role of resilience. So, athletes' greater resilience did not translate into better mental health, which confirms their status as an at-risk group, especially during times of transition. We believe this may be due to the complex and likely uncomplementary role that a strong athletic identity can have during these times. Given the uncertainty surrounding the future of sports and the high likelihood that an athlete might have to take time off to self-isolate, it is important to know who is most at risk of poor mental health going forward. Our findings suggest that those high in negative affectivity are most likely to struggle. In conclusion, this research contributes to the growing body of literature on sport participation and mental health, with the novel addition of capturing demographic and psychological factors during emergence from a national lockdown. We have shown that it is now particularly important to continue to monitor and support the mental health of athletes. Thank you.